Could you be the next victim of whiplash? We'll find out about one method of dealing with it. Then, leave your everyday headaches at home, throw away your pills, and take a cruise on the Nordam. What does soap opera heartthrob John Dino say about becoming a star?
It's all on the Nola Joy Special with Nola Joy Corello.
You could become the next victim of whiplash. Imagine living every day with excruciating headaches or becoming dependent upon drugs to mask some of the suffering. There is a choice besides learning to live in constant fear of when and where pain will strike. We are going to meet Dr. Paul S. Peterson, noted Palmer College graduate chiropractor. Dr. Peterson, what is whiplash?
Whiplash is a term commonly used by people to describe a particular type of injury, most often injury to the neck, but many times to the low back also. It often occurs in an automobile accident, but not exclusively in that. It can occur in, say, sports injuries, for example.
Like football?
Like football, yes. In the car accident, there's usually a force applied from one direction and then a counter force the other way, which may cause the person's neck, let's say, to whip backwards and then again forwards. If they were struck from behind, if they struck something ahead, another car or a pole or a tree or something to that effect, then of course the reverse would be true. They'd be thrown forwards first and then again the counteracting whip backwards. If it's a sports injury, like when I used to take care of a football team at Palmer College, if there's a tackle, sometimes it could cause the neck to whip backwards or vice versa, depending on which direction the force came from. So it's a particularly serious type of injury, especially when you think of the head being approximately the weight of a light bowling ball placed on top of a fairly thin structure of the neck and somewhat delicate structure. And particularly if you don't see the vehicle coming behind you, and if you're at a stop and another vehicle smashes into you from the behind, the relaxed neck, the weight of the head quite rapidly and quite forcefully thrusts the head backwards.
Do you have something you could show us on what the patient would be complaining of, then like a pinched nerve?
Yes, I have a model here that perhaps I could demonstrate. This is a very accurate replica of the spine. Here we're looking at it from the behind. This would be the pelvis, the large hip bones on either side, low back, middle back, neck, and even the base of the skull that forms articulation with the top vertebra of the spine. What we look for in the whiplash type injury, many of the things are seen from the side. Again, remembering the force was introduced either from the front or the back, causing a sudden whipping one direction or the other, in the case of the neck. Or in the case of the low back, if they just have a lap belt, seat belt around the waist, the body is thrust forwards, puts quite a severe thrust or jerking on the low back. The green structures on this model represent the nerves that are coming out of the spine, and it's on both sides. They come out of both sides of the body. Those particular nerves come out of openings, again, formed between two adjacent vertebrae with this felt pad representing a disc that acts like a spacer to keep the bone apart, to keep the hole nice and open for the nerve. If the vertebra should slip, in fact, I'll have you observe that opening. I'll demonstrate as a slip or twist the vertebra, it can actually begin to close down the opening and pinch the nerve in there. Well, the typical medical doctor, when seeing a whiplash type case, he's of course going to look for any bruises, any cuts, any obvious wounds, and of course is concerned with muscle spasm or any possible fractures to the spine. So when they x-ray the patient's spine, that's what they usually look for, any fractures, arthritis, tumors, that type of thing. And of course they can give the patient some muscle relaxants for the muscle spasm and some painkillers for the pain that they're experiencing. And that works to a degree. As long as the pain is there and the muscle tissue, as it begins to heal, then the pain will decrease. And as the ligament begins to repair, again, more pain will decrease. But if the vertebra is still wrenched out of position and still pinching the nerve, you're still going to have those effects. And that's a specialty that I, as a chiropractor, have to attend to. If there's a pinched nerve, the pills aren't going to move the vertebra off the nerve and remove that pinching on the nerve. So that's a specialty, a particular type of treatment that is needed to be done by a chiropractor.
Why is whiplash so easily misunderstood by the medical profession?
Well, I believe it's somewhat in the specialty of training. As I mentioned just a few minutes ago, the medical doctor is going to look for obvious bruises, cuts, and muscle spasms, fractures to the bone, arthritis, that type of thing. Where we as chiropractors not only are trained to look for that and help treat those kind of problems, but also we look to the spine to see if there is a misalignment, a distortion, a vertebra wrenched out of position to an extent we're starting to pinch the nerves. So that's our particular specialty, is to see if there's something affecting the nervous system, which in turn controls all other organs and parts of the body and adapts your body to the changing environment. So we go beyond the typical medical care for a whiplash case and try to restore the spine back to the way it was before the accident. Because if we don't, you tend to have more degeneration starting in the joint. The patient may not experience it for months to years after the accident, but it often does occur if you don't have a chiropractor realign the vertebra, take all the irritation off the nerves, to realign the vertebra as it's sitting on the disc, so the disc carries the weight evenly across the whole surface like it's designed to. So it's a different specialty. We work on the spine 100% of the time, treat nearly all types of spinal problems.
Why do some people believe that chiropractors are members of a mystical cult?
Well, there used to be quite a few people believe that. It, fortunately, is not very many anymore. I think it began from quite a number of years ago when chiropractic was very young, back in the last of the 1800s and early 1900s. A chiropractic premise stated that the nervous system controls all other organs and parts of the body, and you alter the nerve supply of those parts, it begins to cause a dysfunction in those parts, which lowers their resistance and can make them more susceptible to malfunction, which we call disease today. So the chiropractic student says, well, all right, using deductive reasoning, if there's something altering the nerve supply to that part of the body, causing a disease there, if we correct the nervous system, restore the normal nerve flow to those parts start functioning normally, health returns. So chiropractic deals with the cause of disease. And some exuberant students would then say, well, the chiropractic can cure anything, which is not true. Yes. But that word got around, and before they really understood the nervous system, in fact, did control everything else in the body and was the supreme system, we got kind of branded as cults. But luckily now, with more research that's been done on chiropractic, proving our premises, later on the regular scientists determined that the nervous system, in fact, was the supreme system, controlled everything else in the body, and adapted the body to the changing environment. Like I say, we fit more into the mainstream of science, and so not many people think of that. There's still a holdover. Some people, have heard that and believe it, but those people really look into chiropractic and look into our education and what we're doing. Most often don't say that.
What about, people who perhaps are in pain, but maybe they haven't suffered a whiplash? Would you recommend that they should maybe see a chiropractor on a regular basis?
Well, a general rule I'd say a patient could apply here is that understanding the chiropractor is the specialist of the spine. We work on the spine 100% of the time. If they have spinal problems, it's logical that a chiropractor would be probably the first doctor they should seek to determine if it is a chiropractic case or not. Or if they have some nerve-related symptoms, such as a pinched nerve. A lot of people kind of have an idea what a pinched nerve is, or a catch in one of the joints, to say the hip joint or sacroiliac joint, or a stiffness in the neck, or a catch in the neck. They wake up in the morning. Sure, that's an obvious chiropractic case we work on all the time. Sciatic cases, a pain radiating from the hip into the buttocks down the leg. I mean, typical cases we see all the time. The trouble neck, shoulder, and arm, classic chiropractic cases. Some of the other nerve-related ones, as I mentioned, the numbness, the tingling in the arms, hands, fingers, or even legs and toes. It's a nerve-related problem. At least the chiropractor should examine that patient to see if it's something that's pinching or irritating the nerves. Because if it is, really not other form of treatment is going to correct that all the way. And there are others. I mean, like I said, we deal with the nerves that go to the internal parts of the body too, so they can have some changes in the internal organs. And often people do not associate that with chiropractors. They think of chiropractors as being good back doctors, which we are. But really that's like thinking of a telephone lineman as being a good pole climber. Well, he is. The reason, because the wires are up there, you see. We're good back doctors because the nerves are in there, and that's the most common place to pinch a nerve. If the most common place to pinch a nerve was in the knee, we'd be good knee doctors, you see.
How do chiropractors fit into the evolving healthcare system?
Oh, interesting question. I'd say we fit in very, very favorably. I think you've gathered from my discussion so far that basically we deal with the cause of dysfunction, like a television set. If that television set is unplugged, I don't care what you do to the TV set, it's not going to work. First, you want to see if it's plugged in, getting its normal electrical supply. The same is true with parts of the body. First, you want to see if it's getting its normal electrical supply, which is the nervous system and the nerve supply. So that's a logical approach to check that first. Then if it is getting its normal supply, then check that part and see if there's something malfunctioning in the part. But as you stop and think about the healthcare delivery systems today, there's a lot of chaos out there. Medicine is specialized so much. They've got a heart specialist, kidney specialist, reproductive specialist, eye specialist, so on and so forth. the poor patient that has a general complaint, he's totally confused where to go. You know, do I go to this kind of specialist? Do I go to that kind of specialist? Do I go to my chiropractor? Do I go to an osteopath? Do I go to a psychiatrist? Do I go to an acupuncturist? Where do I go? You see? So we're kind of taking over the role of the general practitioner, the switchboard, so to speak, for health problems.
Do you feel that you're being resented by the medical profession then?
Oh, I suppose some. I mean, obviously we're competition, you know, because we're taking over a lot of general health problems and doing things like that. But it's going to come about, but really the only reason any of us are in business are for sick people.
Thank you, Dr. Peterson. If you believe you have been a victim of whiplash or need more information, you may call the Chiropractic Information Bureau of Sacramento at 482-0806.